So, good morning. But I want to start today's briefing this morning by taking a moment to reflect on the death of Congressman John Lewis. He was a civil rights icon. He died on the same day as the civil rights leader, the Reverend C.T. Vivian, who also served side by side with Dr. Martin Luther King Jr. Lewis lost his battle with cancer, but fought frequently as he had for his civil rights. He fought for equality and to empower people in minority communities to be heard. He fought for voting rights, and at a time when what this country's been going through, with the racial upheavals, he continued with a strong message. My condolences go to him and to his family for this extraordinary man that left an extraordinary legacy. So, before I start, I'd like to say to everyone, to the essential workers and everyone else, as always, thank you. And one of the things we're struggling with, we were starting to hopefully get into phase 4. Was going to start, in July, and then everything was going to start to open up July 6th. And then we kind of went into these different little phases as the governor decided he was going to phase things in for obviously good reasons. When do you stop briefing? When do you continue to go on? Some of the things we have to be worried about with the safety and health of everybody, right? And doing this in a way that protects everybody. So, the last couple days, the last couple weeks we had decent numbers. And in the last couple days you have 13 positive cases, then another 13, then the 44, then the 10, then the 8, and today. And you sit there and you're trying to figure everything out. As we continue to get guidance from the control room and from the governor and the governor's people, we're all going to figure this out because we're in this together. I don't want to come on every day like I did before and scare people and put numbers out there, for a couple of reasons and questions we're trying to get answers to ourselves. But as of today, we have 2,096 positive cases of the COVID-19, 644 people under mandatory quarantine, and that's an increase of 17 today. So again, we went from 13 yesterday to 17 positive cases since yesterday. We know that 7 of those cases have been linked to the Hudson Avenue party, which brings us to the total from that party and those associated with that party on July 3rd and July 5th, up to 22 positive cases so far from one party. And it gets into what we've been talking about, tracing, talking about exposures, and how it's a ripple effect. And, we continue to tell people that are going to travel or go to states they shouldn't, or are coming back from their winter homes to self-isolate, to staying in your place for 14 days. Again, it's not about you. It's about the people around you. We continue to get these questions. And on one aspect, well, we had all these riots, we had these protests, why didn't the numbers go up? Look, this party was a huge party. It was in multiple yards. It wasn't in one, but there was a cluster of kids in the same area intermixing, not socially distancing, not wearing masks, not doing the right stuff. The protesters did wear masks for the most part. But it's the thing that I've said, I can't even remember, a month ago, maybe 2 months ago, following that age group from 20 to 29 or 29 to 39, that they have no signs or symptoms. So they're not going to go get tested. They're like, why do I need to get tested? It's not about you. It's about the people around you, and I said this yesterday. So as you continue to go out there and not pay attention of wearing your mask and not socially distancing, hanging out with your friends, enjoying life like it never changed, you're exposing everyone else, and you're keeping it here. It was the same thing in New Zealand when they had 0 cases for over 2 months. And 2 people came from England to there to bury a relative, and they were positive. So it was the first 2 active cases they had in over a month. You can do everything right, but we need your help. And again, it's hard. I remember being that age. You're invincible. You don't think that it applies to you, and you're out having fun. We're not telling you not to have fun. We're not telling you not to go out. Just social distance and wear a mask. That's it. It's not so much, is it? So also, we also know from today's positives, four of them are healthcare workers, two are travelers, and four others had no contact with anyone with positive cases. So that was a different one. So there are now 87 active cases in Albany County. 6,368 people have completed quarantine, and 2,009 tested positive for the virus have recovered. That's an increase of 8 today, which is also good news. There are now 3 people hospitalized with a hospitalization rate of 0.14 that have tested positive. Yesterday's rate was 0.09. So we slightly went up, and that's what I was talking about a little bit earlier. That's what we're really paying attention to, is the ICU beds, the hospitalizations, and how it's affecting. And it seems like this, I don't want to say this is a second wave, but what we're getting into is not affecting us the same way 129 or 19 weeks ago had the effect on this area. So I don't know if it's changed more, if these are things we'll be putting up the chain of command through the governor's office and through the CDC to see why is it, not having that same effect it did earlier on, which is good. But which scares the hell out of me also is the fact that now people are going to say, well, what are we worried about if we're not going to be in the hospital and we're not going to in the ICU? There's things we still need to worry about, and there's things we need to figure out. We don't know. This is all new to us. So again, I will say this, it's a marathon, not a sprint. We can do this together in a partnership, working together, and standing behind one another to figure this out together. But like I said, 0 people in the ICU. Numbers are down. The hospitalization rates are down. Went up a little bit. We had 2 the other day. We got 1 today. These are things that we're going to continue to watch. But our 5-day average of new cases is up to 17.8. So yesterday it was 16.4, so we slightly went up, but that 44 really bumped us up. Every day we're seeing more positive test results like we did from the 4th of July party in Albany. We know there were over 200 people there, so that's one of the concerns of how many people they've had contact in, which we're really getting down to where everyone was at. But I say to everyone, please get tested. And I know I got beat up. One guy was like, well, why would I get tested if I'm not sick? Because if you're out there and you're exposed, you might have it. You don't know that you have it. And it would help us stop the spread. It would help us to continue to open up businesses. We want to see gyms open up. I mean, look at I can't tell you how many gym owners I talk to that have a great plan that put hours when they were shut down, weeks into socially distancing, putting barriers up between stuff. Now are changing out ventilation systems that literally people want to get back to because that helps them to get rid of some of the stress, working out. Even though they're working at home, they like going to a gym, they like seeing their trainers, they like the atmospheres, they know the machines they like. We want them open, we want to see, movie theaters back open, but socially distanced and stuff like that. We want that back. I don't control it. I don't know why it can't open up at this point, but that's where it's at. But in order to get there, we need you to do the right stuff. Then we can get there. So I encourage everyone to get tested. If you're out in crowds and you weren't doing the right thing, please go get tested. It takes literally 10 minutes. Drive through at UAlbany or Seth Q Arena, our mobile testing sites, Rite Aid on Central Avenue. I put the numbers out all the time. How to contact them. UAlbany, please call 1-888-364-3065. If you don't have insurance, you don't have to pay. I know the governor puts this out all the time. We put this out all the time. You have insurance? Yes, we're charging it. You don't have insurance, you're not have to pay a dime, and so that's not a reason not to get tested. So for our mobile testing site, as always, 518-465-4771, and the Rite Aid, as always, go online. And our Purdy one in Gilliland does a great job. Thank you again. Call there, 518-867-8040. You can get the antibody testing done there. But remember, to get through this, you need to just wear a mask properly, cough into your arm, and clean your hands frequently, and keep the 6 feet away from most people. You know who your circle is, you know who your family is, you know the nucleus. But the problem is that now I even see it in my neighborhood, more and more kids hanging out. They're tired. They were cooped up, and someone reminded me I must have forgot what it was like to have small kids at home, and I'm like, oh no, I think they're harder when they're older, but that's for another debate. But it is challenging, and I know that. And kids want to be kids, and they want to play basketball and baseball, and they don't ride their bikes with their buddy. They don't get it. But to protect them children, and to protect the people around them, you have to do the right thing. It's tough. I know it is tough. But would you rather do the right thing for, not 19 weeks now, or maybe a half a year, or be like this the rest of our lives? Who knows? We don't know if it's going to go away, if it's going to come back. And everything we're reading, and yes, Sarah, people say I'm scaring people. Everything that we're reading, being told, it's going to come back in October. That's even if it goes away. And like I said yesterday, we're not only dealing with a health crisis, we're dealing with economy crisis. So tackling all in needs going forward, we need all your help. And we're in this together. We're in this together. I know I sound like a broken record, but we are in this together. So also, I just want to remind people, as always, you can get the hand sanitizers at the Times Union Center, Sheriff's Apple's EOC. As always, they have PPE. We have PPE. So if you need anything, that shouldn't be an excuse now, because now we're getting more PPE than we ever had. It's out there. It's here. People are buying it in bulk, so we can help you with that. But the Times Union Center, to any business, and not just downtown Albany, any business in Albany County, and I will say this, any business outside of Albany County that needs this stuff, please, by all means, call us, 518-487-2023, and any day between 8 a.m. and 6, you can pick it up. Our mental health hotline, I can't thank them enough. They've been dealing with a lot of people, a lot of issues. Don't be afraid to call. Please, man, if you have any concerns, any issues, I don't care how little it is to you. People handle stress differently, and this is what I want to say to people. I know people, I've seen it, and I make that decision. Do I say something, not say something, get in the middle of an argument? I get it. People are on edge, right? You're coming out. People are a little bit more off kilter because you've been in. Some people are arguing with people at stores, or not wearing a mask, wearing a mask, not happy with the rules. I get it. Please call this number. We set this up day 2 for this reason. And look, everyone handles stress differently. And you could be, I have a high tolerance of a threshold of stress because of the job I'm in and being in the military. I'm kind of, and being a former firefighter. But there's other people, and I also have to take a step back at times going, are you kidding me? You're stressed out. Everyone handles it differently. So please, don't be embarrassed. Call. And to the people that have a high threshold of stress, can handle stress, realize that other people can't, and work with them and listen to them. And sometimes just listening is better than talking. Just listen to them. I would say give them a shoulder to cry on or a hug. Can't do that for right now, not unless you got a mask on and they're a family member. But please, by all means, do that. And call our mental health hotline 7 days a week from 8 a.m. to 5 p.m. 518-269-6634. As always, to Karen Ziegler and her team that do a phenomenal job. And unfortunately, we have to have this department, 24-hour sexual assault hotline. These men and women, the stuff they have to deal with is just incredible. And they do such a great job. Karen, to you and your team. Area code 518-447-7716. As always, the United hotline number and the New York State hotline. I do want to end by saying, listen, there's been a lot of people on the forefront, and I can't thank our nursing home staff enough. To the men and women, to their dedication up there, going in there, dealing with, taking care of our most vulnerable seniors, but taking care of them in their crucial hours too. And unfortunately, as we lost people to this, and walking in there every day, and then have to going home every day and making sure they protect their family, it has not gone unnoticed. I can't thank you enough, and I wish I could hug every one of you up there and say thank you for the great job that you did, and the stress that you handled. So thank you.